Good morning, students. Today we'll discuss about the anatomy of the vertebral canal. That is, what exactly is the vertebral canal and what is the significance of this vertebral canal? What are the important contents of this canal that makes it significant? So we will discuss that. So, talking about the definition of the vertebral canal, when the vertebrae they are stacked one upon other, the vertebral foramina of these vertebra they lie one below the other and they form a continuous canal which is known as the vertebral canal, or it is also known as the spinal canal or spinal cavity, because this canal contains the spinal cord. In the intervertebral spaces, this canal is given protection by the following ligaments, that is posteriorly by the ligamentum flavum and anteriorly by the posterior longitudinal ligament. So in this figure, this is one of the vertebrae and this is the vertebral foramen. So when the vertebrae they are stacked one upon each other and the vertebral foramen they together form a continuous canal, that is the vertebral canal. And one of the very important contents of this vertebral canal is the spinal cord. So the spinal cord descends through this canal. The ligaments you can see in the figure, this is the posterior longitudinal ligament and this is ligamentum flavum. So these two ligaments they provide a protection to the important contents of the vertebral canal, especially in the area of the intervertebral space. So the contents of the vertebral canal are going from outer to inner: the epidural or the extradural space, the spinal dura mater, the subdural space, the arachnoid mater, the subarachnoid space, the spinal pia mater, and finally the most important, the vital content is the spinal cord, or also known as the spinal medulla, along with the cauda equina. So this transverse section of the spinal cord is showing the different meningeal, spinal meningeal coverings, that is the dura, arachnoid and pia, and the spaces between, that is the subdural, subarachnoid. So the first content, the first important space related with this vertebral canal is the epidural or the extradural space. So this space is outside the dura, or in other words it is between the dura and the periosteum of the vertebral canal. So the space between the spinal dura mater and the periosteum, along with the ligaments lining the vertebral canal, that space forms the extradural space. The constituents, the contents, the important components of the epidural space are loose areolar tissue, there is fat which is semi-liquid in consistency. Two very important components are the spinal arteries that would supply the spinal cord, the spinal nerve roots, the periosteum, ligaments and the meninges. Another are the vertebral venous plexus, the internal vertebral venous plexus or the epidural vertebral venous plexus, which receives the venous blood from the spinal cord. So these are present in the extradural space. So you can see here these the arteries, the spinal arteries, and the epidural venous plexus and the spinal arteries. They are present in this space. This is the vertebral foramina, and this is the spinal cord, the transverse section, and this is the epidural space where the arteries and the venous plexus are present. The spinal dura mater is again dura is the outermost, it is the thickest, it is toughest membrane. It loosely surrounds the spinal cord. And when we had talked about cerebral dura mater, we had seen that there are two layers of the cerebral dura mater, that is the endosteal layer and the meningeal layer. So only the meningeal layer of the cerebral dura mater continues down to form the spinal dura mater. The endosteal, it does not descend down, only the meningeal layer descends down. It extends from the foramen magnum up to the lower border of the second sacral vertebra. This spinal dura mater also provides tube-like prolongations to give protection to the dorsal and ventral nerve roots as well as the spinal nerves. So you can see the spinal nerves, they pass from the intervertebral foramen. So they are liable to injuries, and hence the dura mater also gives protection to these nerve roots and the spinal nerves as well. This is the intervertebral foramen from which the spinal nerves, they are coming out. The subdural space is a potential space. The next content or the next space of the vertebral canal is the subdural space. It is present in between the dura mater and the arachnoid mater, and it contains serous fluid, that is thin film of serous fluid. So because it is because of this space, dura is able to move or slide on the arachnoid mater. This space continues for a short distance up to the spinal nerves, where they are in free communication with the lymph spaces of the nerves. Next meningeal covering is the arachnoid mater, which is a very thin and a delicate membrane. It is transparent. Loosely it is attached to both the brain and the spinal cord. It is only adherent to the dura where either some structures are piercing this membrane or where the ligamentum denticulata is piercing or attaching to the dura mater. So because it is a thin membrane, so there are possibilities of its tearing. So wherever any structure is passing through this membrane, it is adherent to the dura so that it doesn't get torn off. Inferiorly, the arachnoid also extends up to the lower border of the second sacral vertebra. So this picture is showing the spinal cord with its various meningeal layers. So this is the dura, spinal dura mater, the toughest one. This is the arachnoid, and this inside is the pia mater. And you can also see the denticulate ligament in this figure, which is nothing but a modification of the pia mater, and it gets attached to this dura and it suspends the spinal cord inside the subarachnoid space. So the subarachnoid space is a white space and it is present in between the pia mater and the arachnoid matter, contains CSF, that's the significance of the subarachnoid space. It surrounds the spinal cord, so it gives a cushion-like support, the CSF. And the point of differentiation between the subarachnoid space of the brain and the spinal cord is that the spinal subarachnoid space is wider than the space around the brain, and it is widest below the lower end of the spinal cord, where it is supposed to enclose the cauda equina. So that's all for today's lecture. The remaining contents we will be discussing in the coming lectures. Thank you so much.